мекендештер, арбаңыздар буйруса Сауд-Аравиянын борбору Эр-Рияд шаарына негизги иш сапарыбыз менен келгенбиз. Бул сапарыбыз албетте жалпы международный медициналык конференцияга келгенбиз. Албетте чакыруунун аркасында келгенбиз. Аллах таала чектүүлөр болсун, мактоолор болсун. Мына азыр дүйнөлүк деңгээлдеги доктор, профессорлор катышуусунда биз дагы мына ошол конференцияга катышып атабыз. Жана кандайдыр бир өзүбүзгө бир тажрыйба алып атканыбызга шүгүр кылабыз иншалла.
Because our outcomes tend to be getting worse over time.
Similarities and some pathways for us to collaborate. I think the second point that I think is incredibly important is also the shoulder to shoulder and hand holding hand during implementation phases of transformation. I think it's very simple and perhaps a little bit not sufficient to provide a wide bulk of action on how to seek perfection. I think seeking perfection is a very lengthy journey. It's a marathon. It's not a sprint race. So working together collaboratively, doing that are long-term collaborations. And lastly, and I think very importantly, and addressing specifically your question, how do we adapt to the ever-changing health? How we move forward? First, and most importantly, with the care of our patients. Secondly, advancing research and innovation to support that care. And thirdly, developing the workforce of the future to adapt to this world of new resilience and new world of opportunity. As Dr. Michael referred before, resilience starts with oneself. We perceive that resilience is an opportunity.
Ruining certain things at the moment. Twitter. And there's something to be said about that in terms of you have to welcome ideas from all demographics, and I think the Kingdom does this really, really well in the sense of what they want, the leadership looks at what they want to achieve here, and that's why it's transforming so quickly. So speaking of transformation now, Corey, you mentioned that your organization recently underwent a major
journey of planning and structuring and organizing the build, and then also training our staff. And so we really spent a lot of time with our leaders on change management, how to help prepare our team. We trained a lot of the staff to be super users so that they could help their peers. We trained the leaders on how to support the team through change. We did a lot of wellness activities, right? Because that's also part of taking care of ourselves. Fun days, dressing up a stage for our team that while we spent 2 years and we spent a lot of time and effort putting this together, things are not going to be perfect on Go Live. Right? We went live at 4 a.m. And so I think that helped reduce some of the stress load on them. And then they also had heard tidbits of the new terminology throughout the 2-year process, so that when things went live, it wasn't just
whether here or throughout your career. When managing such a big team, such a diverse team, how do you approach crisis management? And can you think of any specific examples of a strategy that proved effective, even if it's not from your own workplace, but globally? What kind of strategy really helps tackle crisis management?
Yes, thank you, Rachel. So the obvious one to pick is COVID, which I think certainly the largest crisis in inverted commas in my healthcare career. Are accidents waiting to happen, really, and they are absolutely obsessive about training, drills, retrain, practice. And I think healthcare could learn a lot from Aramco in that respect. So we get very fired up when something comes along. We were reasonably well prepared at Johns Hopkins because we had the MERS scare here in Saudi Arabia a few years before.
Communicate, as you just mentioned, in a timely manner, being transparent, receive feedback and answer truthful feedback. You are winning their mind because they could trust you and they understand that you are sharing the information with them. On the other hand, when you are emotionally intelligent, then you understand their emotions, their worries, their insecurities. And when you have a synergy between mind and
the most interesting element of this summit, the Leaders Summit, is the ability to bring you speakers, experts, and healthcare professionals literally from all over the globe flying in today to share their experience. We've heard a lot over the past 48 hours and the past two themes that we have delved into about innovation and how technology has been helping healthcare professionals, be it bringing care and bringing solutions to patients in remote area, or using technology to bring more equity to patients from all over the sectors that we're discussing. I'm delighted to introduce our next speaker. She is quite well known in her field. She's been an advocate of healthcare, an advocate of women healthcare. She's truly distinguished in the industry and has been a pivotal force in shaping the strategic
keeping people healthy. And that was the genesis of what started with the Thrive campaign that Kaiser Permanente built, that became an award-winning campaign across the world. Thinking the KPIs of the nurses, the doctors, the clinicians, everyone. So one of the things that I learned from this lesson was that we need to be asked
time is and how many meetings he has going on and whatnot, and there was conversation as to whether it's going to happen or not, and we're so thankful that he was able to join us today for this panel. So without further ado, Professor Naufal Al-Jaryan, I'd like to introduce him. Please join me in giving a warm welcome. He is the CEO of the Saudi Medical Referral Center. Welcome, Professor Naufal. Welcome, thank you. Thank you, Professor. Lovely to meet you. You may stay here next to me. And joining Professor Naufal, I'd like to introduce Christina Podnar, who is a digital policy consultant, joining us all the way from Canada, I believe, today. Welcome, Christina. We have Pilar Fernandez-Hermida, who is Pilar Fernandez-Hermida, health tech and commercialization expert, and somebody who is very well known in the UAE for her work in platforms. We have Dr. Mustafa Shaheen, Chief Medical Officer at Daman, the national health insurance company from the UAE as well. And last but not least, I'd like to welcome Dr. Hani Al-Enezi, Senior Executive Director of Medical Governance and Quality at Saaoudiya. Welcome, Dr. Hadi. We have a very diverse panel. We've got UAE. So we had a backstage mic working, but then the front ones may not. It happens. It happens. Team, may we have Professor Naufal's mic working, please? I think it's working. No? Okay.
Startups is like, what is your platform strategy? Do you do anything integrated, endpoint, journey? You are a platform place, so are you going to be a orchestrator or are you going to be a complementer?
The first part about the role of the case-mix center. So we are we're born as a result of the new transformation that is happening in the ecosystem, and mainly the healthcare financial transformation. So we are shifting the whole and need to demand side, and that requires a lot of prerequisites, and have a new innovative up-to-date regulatory entity in order to start standardizing
programmatic or pathway approach to the ultimate outcome being paid for.
Allow me with something here. So this is a policy decision completely for them. So maybe it's the starting point, it's a policy decision. Maybe right now it's easy, not that easy, but if we might require more facilities or more infrastructure, and this is where might be the PPP more viable in that situation. I don't know.
The Aura Ring is a great device and we're going to try to get it on a huge portion of the at-risk, high acuity population of increase the HbA1c or improve their sleep or define some outcome-based KPI. There's some upside. Is this the official launch of that?
Yeah, I'm happy to support that. We can take it to the innovation fund and let's make a project out of that.
Perfect, that's great. Great way to close. Thank you everyone for your attention, and thank you to our panel. Thank you.